Hello anatomy friends. Don't worry, this isn't the spaceship of an alien invader. This is something that everybody has in their neck. This is the second cervical. Yes, this is the axis. C2 axis. The axis, also known as the epistrophe, is the second cervical vertebra, C2, which has some similarities to a typical cervical vertebra, but is classified as an atypical vertebra due to its unique characteristics. The prominent superior projection known as the dens axis or odontoid process is its most distinctive feature. The dens axis acts as a stable fulcrum around which the atlas and head rotate, and it plays an important role in the movement of the head. Synonyms: Epistropheus, Vertebra C2, Vertebra cervicalis 2, Vertebra dentata, second cervical vertebrae. Location and structure. Located in the upper portion of the cervical spine, the axis is the second vertebra of the spine. It articulates with the atlas in the upper part and with the third cervical vertebra in the lower part. The axis can be divided into an anterior component and a posterior component. Anteriorly, the axis consists of one vertebral body, one dens axis, two pedicles, and two transverse processes. Posteriorly, it is composed of two thick laminae and a large, often bifid, spinous process. These anterior and posterior components together form a circumference called the vertebral canal, that provides passage for the spinal cord. Anterior components. Vertebral body. Compared to the vertebral bodies in the rest of the spine, the body of the axis is small. It is a composite structure. It consists of the partially fused center of the atlas and the axis, with a rudimentary intervertebral disc between them. The anterior part of the body of the axis is extended downward, overlapping the upper and anterior part of the third cervical vertebra. On its anterior aspect, the body of the axis has a medial longitudinal ridge that separates two lateral depressions that serve as attachment points for the longus colli muscle. The anterior border of the body of the axis provides attachment to the anterior longitudinal ligament, while the posterior longitudinal ligament and tectorial membrane attach posteriorly to the lower border of the body of the axis. The upper surface of the body appears to project a tooth-like process called the odontoid process. This structure actually represents the atlas body, which separated during early fetal life and fused with the axis body. Lateral to the dens axis on each side are the superior articular facets, sloping from the superior body aspect and extending over the pedicles. The inferior articular facets are located on the inferior aspect of the body. The lateral atlantoaxial joints are formed by the superior articular facets articulating with the inferior articular facets of the atlas. The superior articular facets allow one lateral mass to glide anteriorly while the other glides posteriorly. This allows the atlas to rotate about the dens, allowing rotational movements of the head. The inferior articular facets begin at the inferior aspect of the body and extend over the pedicles of the axis. These facets join with the superior facets of the third cervical vertebra, C3. Dens axis. The dens axis, literally, tooth of the axis, also called the odontoid process or the peg, is the separated body of the atlas that fused with the body of the axis during early life. It exhibits a small constriction called the neck, on the place where it fuses with the body of the axis. The posterior surface of the dens axis is smooth and contains a posterior articular facet traversed by the transverse ligament of the atlas, which keeps the dens axis secured in position. The anterior surface of the dens axis contains an oval anterior articular facet. This facet articulates with the facet of the anterior arch of the atlas to form the median atlantoaxial joint. This is a synovial pivot joint that facilitates rotational movements of the head on the neck, such as shaking the head to say, no, or turning the head from left to right. Lateral to the articular facet of the dens on each side is a rough impression that serves as an attachment point for the alar ligaments, which connect the dens to the tubercles on the medial sides of the occipital condyles. The apex of the dens axis is slightly pointed and provides attachment to the apical ligament, which connects the dens axis to the anterior margins of the foramen magnum. Pedicles. The pedicles of the axis are broad and strong. They project laterally on each side from the body of the axis to the transverse processes. On its upper surface, each pedicle contains a portion of the superior articular facet. This facet slopes away from the body of the axis. A deep groove for the vertebral artery, which carries the vertebral artery, vertebral venous plexus, and suboccipital, first spinal nerve, is located on the anterolateral surface of the pedicle of the axis. The inferior surface of each pedicle contains a deep inferior notch. This notch supports the large root sheath of the C3 spinal nerve. Transverse processes. Projecting laterally and inferiorly from each side of the pedicle, lamina junction is the transverse process. The transverse processes are small and pointed. They do not contain the anterior tubercles found in typical cervical vertebrae. The posterior tubercle of a typical cervical vertebra is homologous to the rounded tip of the transverse process. Each transverse process is pierced by a foramen transversarium, transverse foramen, which is oriented obliquely in a superior and lateral direction. The vertebral artery and vertebral vein pass through the transverse foramina of the cervical vertebrae. Posterior components. Laminae. The laminae of the axis are thick and strong. They project posteriorly and medially from the transverse process and join in the midline to form the spinous process. The lamina of the axis serve to attach to the ligamenta flava. Spinous process. The spinous process is formed by the fusion of the two laminae of the axis. It is large and usually broad-based and bifid-tipped. The spinous process covers the spinous process of the third cervical vertebra, C3, and projects nearly 1 centimeter posterior to the posterior tubercle of the atlas. The apical notch of the axis spinous process serves as an attachment point for the nuchal ligament. That's it for today. But before we end, let's go over some of what we've learned. The axis, also known as the Epistropheus, is the second cervical vertebra, C2, located at the top of the cervical spine. The axis can be divided into an anterior component and a posterior component. Anteriorly, the axis consists of one vertebral body, one dens axis, two pedicles, and two transverse processes. Posteriorly, it is composed of two thick laminae and a large, often bifid, spinous process. These anterior and posterior components together form a circumference called the vertebral canal, that provides passage for the spinal cord. And that's all for today. I hope you have enjoyed getting to know the axis. To make sure you don't miss the next installments, don't forget to subscribe. And please give us a like.